everyone. My name is Dr. Supratik Bhattacharya, and today it's an absolute pride and pleasure to have with us Dr. Neeta Deshpande. Dr. Neeta, MD FRCP Edinburgh and post-graduation endo from London, ASBP obesity certified from USA, and he's the senior consultant diabetologist and bariatric physician. She's also the director of Belgaum Diabetes Center, Watch Children's Diabetes Center. She's the professor and head of the Department of Medicine, Dental College, Belgaum, and also associate professor of medicine, USM Kelly International Medical Program. She has several presentations on obesity and diabetes in national and international meetings. She's done publications in peer-reviewed journals and textbooks. She's been the past chairman of Karnataka RSSDI, principal investigator for several clinical trials, KRSSDI oration for 2016. She received the RSSDI fellowship in 2016 and FRCP Edinburgh, December 2016. She has been the coordinator of the consensus group RSSDI ESI clinical practice recommendations for type 2 diabetes 2020. And she is a close personal friend as well. So it's once again absolute privilege to introduce to you to Dr. Neeta Deshpande.
Thank you so much, Dr. Bhattacharya. And today, I should thank the organizers also for giving me this opportunity to speak about this molecule and this class of drugs in particular, which is the rage now. And I would say, I wouldn't be wrong if I said that it's the molecule of the century, actually speaking. And I shall launch into certain aspects of it, especially about the heart failure aspect, which is being talked about now a lot with respect to diabetes and otherwise also. So here we're going to talk about diabetes, heart failure, and dapagliflozin. Well, just to give you an introduction of the connection between heart failure and type 2 diabetes, let's first look at the burden of heart failure in type 2 diabetes patients. We all know that diabetes increases the risk of heart failure twice in men, twofold, but fivefold in women. And the term diabetic cardiomyopathy, which is basically heart failure, was coined 40 years ago. So in general, we know now that patients with diabetes mellitus are at greater risk of developing heart failure than their counterparts without diabetes, and the risk is at least twice those of non-diabetic individuals, which is considerable. If you had to look at why this is so and what the pathophysiology of heart failure in diabetes is, to put it in a nutshell, we all know that pathophysiologically in diabetes, what you have is hyperglycemia, insulin resistance, and hyperinsulinemia. And this triad which is there is responsible for several metabolic problems. For example, you have inflammation, dyslipidemia, and endothelial dysfunction because of this triad of metabolic abnormalities, which of course predisposes to coronary artery disease, and that can lead to ischemic cardiomyopathy, and this can lead in turn to heart failure. Also, there are other mechanisms by which diabetes can predispose to heart failure, and that is cardiomyocyte hypertrophy or LV hypertrophy, which can again lead to diabetic cardiomyopathy leading to heart failure. Also, you can have the renin-angiotensin system to get activated, which in turn leads to this cascade. Also, you have autonomic dysfunction. There could be disordered calcium handling, formation of advanced glycation end products, and all of these together contribute towards diabetic cardiomyopathy leading to heart failure.